is 2:30. Welcome to Cook County Health Department Schools and COVID-19 update. My name is Kelly Jones. I am a health educator senior in our Community Engagement and Health Education Unit. I am your moderator for your webinars. Before we, we have a guest presenter. Before I give the floor to our presenter, I just want to give a couple resources. As you know, our outreach efforts for COVID are slowing down, so there aren't as many resources to report, but I still want to make sure that everyone has this information in case they need it. We continue to support our schools while navigating COVID-19 and answer any frequently asked questions, provide CCDPH contact information and resources. Couple announcements. As you know, currently we are in a bi-weekly format for our school health conference. We will be having some conversations about whether we need to continue a bi-weekly format or whether we'll devolve back to what we originally were doing with our school health webinars and just have it school health and services with an occasional COVID-19 update. So please stay tuned. We'll let you know when we decide to make those changes. As for now, we'll continue our bi-weekly format and you'll be made abreast of any changes we make. Our webinars are all recorded and they are uploaded to our Cook County Health Department Schools website as well as CCDPH's YouTube page. We start promptly at 2:30. Please make sure you keep your line muted. We don't want to disturb anyone. I've disabled the chat so we can make sure that everyone is paying attention to the presentation and your question may be answered in the presentation. I will re-enable the chat when our presenter finishes and is ready for Q&A. I'd like for everyone to confirm their email address is correct in their registration. I've gotten quite a few return undeliverable. I want to make sure that everyone gets the resources that I send out. So please just confirm the correct email address in your Eventbrite registration. Thank you. If you need any of the following information to contact Cook County Health Department, there is the COVID-19 general email where you can send your webinar related questions and concerns, the CCDPH communicable disease reporting email where you can do your line list and report any communicable diseases or metrics, the CCDPH website, the school specific website, and other tools that you may be able to use if necessary. If your school would like to participate in the EpiPen request program, make sure you send those to me, Kelly Jones at kjones1 at cookcountyhhs.org. Make sure that those requests please come from a medical professional, i.e. a school nurse or someone who has been trained and certified in the administration of medication, and make sure you type those requests. Thank you. As you're aware, you can still request those COVID-19 tests if necessary. You can order them online, and I heard that the shipping is much quicker than they were at first. I believe they were about 3 weeks out initially, but they're coming pretty quickly, and people are still having use for that. My mother wasn't feeling good earlier this week, and I told her to go test herself, so they are very useful, and you don't have to go out and find a testing site. If you don't want to order it online and then you'd like to get it immediately, you can go to any pharmacy and you could either have them run your prescription, run your insurance, or you can get reimbursed from your insurance. If your school is interested in the Binax Rapid Antigen Program, please fill out the form and all the information is on the website provided. If you have any concerns about any testing sites, you can report to the Illinois Attorney General's office at the phone number below, and there's also a TTY number below. If you're interested in or have any questions about the Shield testing through IDPH, you may contact Beth Heller and her team at the following email address. As I stated before, there aren't many outreach events going on right now. They have settled down a bit, but there is still a need. People are still getting positive. So here's an event that is going on tomorrow in Sauk Village. In addition to vaccination and testing, they're also doing voter registration, which is important. And then here's a list of all our county clinics if you'd like to go for any general medical issues or you'd like to go get your vaccine for yourself or your family. And if you look at our Cook County website on the calendar page, there's information on upcoming events throughout the community, as well as webinars, Ask the Doctor events, and things of that nature. So feel free to go check that out for more information. I just shared this about an upcoming mental health family to family free 8-week session through NAMI, and the flyer will be attached to your resources afterwards. And it's just some more information on school health clinics, and frequently asked questions and tips on how to host a clinic if you're still hosting a clinic, or any educational resources that you may need. And the following are more educational resources. Feel free to check that out if necessary. If you're still interested in having a speaker come to your organization, you can click the link and request a speaker from our Speakers Bureau. And we are still offering rides through Destination Vaccination. So you can call the 833 number if you're interested in getting a ride, as well as we're offering the at-home vaccinations for homebound persons, as well as the people who live with them. You can request all that information there at the following link. Thank you very much. And I am going to introduce Denise Holman, who is a health educator with Cook County Health Department's Behavioral Health Program. She is going to speak to us about the Narcan distribution program here at CCDPH. I've gotten quite a few questions about it recently, so I thought it'd be a great idea to have Denise come on and share information about the program. I'll stop sharing, and Denise, you can have the floor. Welcome, Denise.
Thank you, and thank you all for having me today. As Kelly said, I'm Denise Holman. I'm our opioid health educator with Cook County Department of Public Health. And I have just a quick presentation to talk a little bit about overdose prevention, as well as our naloxone program. So looking back into the data as far as why we are very interested in having opioid prevention is because, or opioid overdose prevention here in Cook County, is because in the last few years, I'm only showing the last 3 that we have data on, we have seen that opioid-related overdose deaths has continued to climb in Cook County. As you see, we have the whole entire county, Chicago, as well as suburban Cook County. And we just received the data actually not too long ago from 2020. As we see is a significant increase on opioid-related deaths that has occurred throughout the whole county. So to give a quick little geographic disparities in opioid overdoses, we are seeing that in a lot of our townships that have a low and medium household income, there's higher rates of poverty as well as higher rates of opioid-related overdoses. This video is something really quick that has actually occurred in Connecticut about 2 months ago, and then there was another opioid-related overdose death that happened a few weeks after that one. So I would just quickly go over this video to explain why I'm here today. In this case, there was a 13-year-old child who had an opioid overdose death that occurred in school. This child and 2 other children were allegedly smoking weed that was also laced with fentanyl, and it led to all 3 children having to be hospitalized, but 1 child actually passed from fentanyl opioid overdose death. A few weeks later, there was another situation in the same township. However, it was in a high school with a 15 or 16-year-old student. So we have seen over the years that there has been opioid overdoses that occurred in schools, but we want to make sure that here in Cook County, if that was to occur, that we wouldn't hear about an opioid-related death. So going into that.
Did you want to try to click the link and go straight to YouTube and play it if you have the time? It's up to you.
I can send the link to it because it's about 3 minutes and I don't want to take up too much of people's
Okay,
time.
take your time. You have time.
Yeah, but I will send it over to you, Kelly, so they can also see it. So here at Cook County Department of Public Health, what we're looking to do is that we have 4 major components in our opioid overdose prevention initiative. One is training opioid overdoses and naloxone use for community-based organizations and law enforcement agencies. Distributing naloxone to community-based organizations and law enforcement agencies. Technical assistance in establishing deflection protocols and programs. and quantitative and qualitative data collection of opioid use disorder, and opioid overdose to help inform public health efforts. Um, so with our naloxone distribution program, we have been working with a lot of community-based organizations within the last year, but we have realized that we have done a disservice to our school districts by not helping and distributing naloxone to those organizations, or to the schools. So what we initially started off with was going to housing providers, syringe access programs, and substance use disorder and MAT treatment programs. And what we're looking to do next is we want to start working with suburban Cook County schools and training staff. That includes the nursing staff at the schools, as well as teachers, teachers' aides, anyone who's working in the school, and overdose prevention and naloxone use and distribution of naloxone. After we have trained the staff at these schools, we are looking to also train the students in overdose prevention and to moderate distribution of naloxone to students and their families. So that is it of my presentation. I have also attached my email, and Kelly will also send out my email to you all. So if there's any questions that you have about the program, we can talk about it now. Thank you.
I have opened the chat if anyone has any questions for Denise, and I will help moderate those questions so it'll be a little easier. Sometimes it can be hard to present and see the chat. So we'll just wait a couple minutes and see if anyone has any questions they'd like to ask Denise. How do we request, and what is the cost associated with it?
So you all can send me an email and I will send you the link so we can set up appointments, as well as being able to figure out how much naloxone you would need. And since this program is with us at Cook County Department of Public Health, it is free of cost to you all.
Is there a standing order provided through Cook County Health Department?
So far, we haven't had it as a standing order, but we do have it available that if there's a request for a refill on naloxone, we are glad to refill that for you.
How long is the length of the training for staff?
Most of the time, it's about anywhere between 30 minutes to an hour. It just depends on questions. Also, I make it that if it's in person, trying to make it interactive so people that actually have that opportunity to practice using naloxone.
Okay. Thank you, Denise. Any more questions for Denise? Continue to enter your questions if they arise. Sometimes you think of things after the fact. However, what I'm going to do is when I send out the information after the training and I have the list of resources, I have added Denise's contact information. So if you have any questions that didn't get answered here, then you'll have Denise's contact information, and I will send out her slides as well. There was a couple questions. Do you come on site for training?
Yes, I do. So some places are comfortable with just online training, and that's fine with me. But if places want me to come in to do the training, I'm more than happy to come in.
Okay. Is the medication provided to the school health office?
So it would be provided to the school. It's up to the school to figure out how they want to um, disseminate it throughout. So some places it might be directly in the nurse's office or the school health office. Other places would disperse it in other places just in case there's that need and it's easier for people to access. So it's pretty much up to your school how they want to place the naloxone.
Okay, I got a message privately. Is this for elementary schools and high schools or one or both?
Both.
Okay, that's a sad state of affairs, but it's much needed. So that's great. And while we're waiting on more questions, I have a question. If the school is interested in working on a plan for distribution, are you able to work with them to work on that plan?
Yes, I am. So that's something we also were thinking about when we decided to work with schools, was figuring out how we can make this program efficient for them.
Okay. Another question, how many doses will be provided to the school? Is it based on the number of students?
So we pretty much have set it up where we ask organizations to put in how many they think would be sufficient for them. We don't put a limit to how much we would give out to these organizations, but we also ask that when we do uh, give it out, that if there was ever a time that was used, that you will report to us the use of the naloxone.
Okay, great. Are there any more questions for Denise? Denise, I know you have a meeting this afternoon, so you can't stay for the whole time. So we want to try to get these questions to you as quickly as we can. If not, as I said, her contact information will be shared after the webinar with the rest of the resources, and you'll be able to ask her any questions you may have forgotten. So we'll give her a couple more minutes, and then we can release Denise. In the training, will you include the variety of ways that students are consuming this, such as they're consuming via brownies and other pastries made at home?
Yes, so it's more so that we look at the opioid use, and opioids typically aren't consumed that way. Um, as is marijuana is usually consumed that way, but that is something that we could definitely add into the training, is the different ways that it's consumed.
Sounds great. Okay. The chat got a little quiet, so I know that you have to go, Denise, and we want to thank you for taking the time out to meet with the school staff, and it's a great opportunity to get information out about this program, and it's much needed. Again, we want to thank Denise, and we'll make sure we send out Denise's contact information with the resources if there were any questions that you thought of afterwards.
Thank you all and have a good weekend.
Thank you, Denise. Appreciate it. Now I'm going to toss it to Lex so that she can provide her communicable disease update. Hey, Lex.
So not a whole lot of new content, but there were a couple of things that we've gotten repeatedly in the email that I wanted to go over for everybody. You guys know the drill with how to contact us at this point. All right, so the first thing, I hope there's some admin on here because I want to remind everybody that reporting infectious diseases is Illinois law. It's been Illinois law for years and years and years before the pandemic. It's codified, it's official. There's a long list of diseases that you have to report. And I have attached all of the relevant links for reading the communicable disease code and the administrative code that apply, in case you wanted to pass that information on to your district attorneys to look over when you guys are kind of updating your COVID policies. So reporting is the law. There is COVID specific guidance as well, because some of our infectious disease posters haven't been updated since 2019, so COVID wasn't on there. But COVID is reportable by law. It's supposed to be, within 24 hours. I know sometimes that can be difficult, but do your best with that. Close contacts must be identified, monitored, and quarantined, and that's where we're working together with you, the schools. So that is by law a requirement. Contact tracing still has to be going on. And then it's also the law for schools to cooperate in case investigation, especially when there's an outbreak situation, which luckily you'll see in the next few slides are much fewer and far between than they have been. But these are things that are required by law, have not been impacted by any of the more recent court rulings. Those were about emergency orders, and the mask mandate was a measure we were using for mitigation, but wasn't part of this, law where you're required to report, you're required to exclude people who are potentially infectious. So, as a reminder, school personnel are mandated reporters as you are for other things. I know you guys have that annual training and things like that. So you're a mandated reporter for infectious diseases as well. This is only a snippet of the things that need to be reported. Hopefully you only come across COVID and one or two of those, but I do know now that we've lifted some restrictions, we are seeing a little bit of chickenpox, a little bit of RSV, and a few other infectious diseases. So as a reminder, keep up hand hygiene. That's still really important. But going on to the metrics, we're doing pretty well, which is really exciting. So I've drawn the line between where we are now, so you can see we're kind of back to where we were towards the beginning of the school year. And if we keep heading in a downward direction, fingers crossed, we'll hopefully have a summer where we can worry significantly less about what we're doing, where we're going, and things like that. So we're on the right track. Still in low community transmission, that's been quite consistent. And if you look at the number of active outbreaks for the state and for Cook, they've cut in half since the last time we spoke, which is amazing. So again, things are looking up. I don't want to be too optimistic because sometimes that comes back to haunt me, but looking good so far. All right, travel guidance. This is the most yellow we've seen in ages. There's a lot of safe places to travel to for spring break. Of course, on like planes and trains, you have to be wearing masks, but there are safe places to go where unvaccinated people would be more safe to go. Again, if you're going to travel, still always a good idea to be up to date on your vaccines, get boosted if you haven't, but the map is starting to look a lot better, which is really encouraging, and we would also be considered yellow. This is kind of the same as usual, except for I did want to mention cruises have been taken down a risk peg. Still up there, but not a complete no-go, bad idea, do not do. So that's great too. Still cautionary with cruises, but we can make it work, you know. All right, I just wanted to give you guys a few science updates, and then we'll talk about some of the frequently asked questions we've been getting. Just to bring stuff to your attention, especially with regards to Omicron. So, to point out, younger children, and we're talking like below the age of 5, were hospitalized 5 times as much during Omicron as they were compared to Delta. And that mostly has to do with the infectious power of Omicron instead of the severity of the variant. So it's just because it infected so many more people. But that is something to keep an eye on, you know. It's not that easy to dismiss that kids have less severe infections. It's true that as an average, it's a little less severe, but people can still be at risk, and young people, especially whose immune systems are still developing, that are very different from adult immune systems, it's important to make sure we're still protecting those who aren't able to get vaccinated yet. So that's the first bullet point. Second bullet point, just to show you guys that you have been doing the right thing so far. In Arkansas, districts with universal masking requirements had 23% lower COVID among staff and students compared to districts that didn't have any requirements. So that is quite significant. Good job keeping that up. I can't imagine what it would have been like if we weren't working on that. Next bullet point, and of course, if you wanted to read any of these, I've got those links too if you wanted to go into the studies. I'm sure you guys are busy, so I don't blame you if you don't. But these are just the big science headlines. Approximately 1/2 of Omicron infections in unvaccinated children and adolescents were asymptomatic, which is a little bit bigger than we've seen for other variants. So, you know, still watch out for asymptomatic infections, especially in young people. And then 2 doses of the Pfizer vaccine is still effective in reducing Omicron, but it has been impacted compared to Delta. You know, it has a mutation that allows it to evade the immune system a little bit better than previous variants. So still effective, but less so than we've seen with other variants. So it's still important to be cautious, even if you are fully vaccinated, when we're not in, you know, this low transmission setting. It's still among us. We haven't gotten over it yet, but we are heading in the right direction. And then in the NFL, 46% of vaccinated players who ended up becoming cases tested negative by day 6 after their diagnosis. So that means about 46% were basically no longer infectious after day 6, most likely because they were vaccinated beforehand. But that still leaves over 50% who were still likely infectious after 6 days. So that's why it's really important, and this shows that the science supports wearing a mask after day 5 through day 10 when you're in isolation, because a lot of people are still going to be spreading COVID. And I mean, the NFL, you've got obviously a lot of close contact with practice, but that's a pretty significant number. And then last bullet point, Omicron infection resulted in high transmission among household contacts. I know we've gotten a lot of worried emails about household contacts, particularly among those whose first case were not vaccinated, or if it was a household that decided not to take any kind of mitigation measures to protect the people within the household, like masking up when they're around others, or opening windows. It was hard to do that in winter, obviously, but Omicron can blow through a household. It's really important to make sure that we are quarantining any unvaccinated household contacts, because it can really go through a house. All right, so that's the science update. What does this summarize to? What should schools be doing? As I just mentioned, all of our public health recommendations are informed by heavily researched science. You've seen the studies on the previous page. These numbers, 10 days of quarantine doesn't come out of nowhere. Masking doesn't come out of nowhere. We've seen time and time again that these are really important practices to protect people. So first, encourage masking, even if it's not required, especially if you've got a setting where there might be an immunocompromised student in class, or some students with diabetes, or the teacher is pregnant. Still encourage masking. And then for people who are returning from being symptomatic, returning from quarantine, returning from isolation between days 6 and 10, they have to wear a mask. That is part of the definition of their quarantine and isolation. If they can't mask, or you can't enforce their masking, then they have to be out for the full 10 days. That's very important, as you saw with the study. Of course, staying up to date with vaccines is an important measure. And then contact tracing is still really important. We've still got a big contact tracing staff, and we're tailoring our approach to, school settings, to long-term care facility settings where people are much closer together. It's a more congregate setting. So contact tracing is still really important, and it's still required by Illinois law. So please continue to send us those spreadsheets to the best of your ability with as much information as you have, and we'll help you through that. It's important still, especially in the school setting, to be identifying close contacts, especially if they're not vaccinated. And again, I've mentioned this before, but if you have a big concern that someone isn't going to wear a mask when they return from quarantine or isolation, or won't even isolate or quarantine in the first place, contact us and we can help write up an order for them to either quarantine or isolate, and go through that legal process to help you enforce that. You still have the legal ability to exclude people. And again, that is linked in these law pages. So for non-emergencies, so that not including the emergency order that had been impacted by the ruling, persons suspected of being infected with a reportable infectious disease for which isolation is required, like COVID, or persons with diarrhea or vomiting believed to be infectious in nature, so not just you know what, they can't have dairy and they had a glass of milk, shall be refused admittance to the school or childcare facility while acute symptoms are present. You have the ability to exclude people who are symptomatic, or have tested, positive, I mean. So that is an important part of your ability to keep people safe. You would do that for something like chickenpox. If you've got a kid home with chickenpox and they've got a younger sibling who isn't quite fully vaccinated against chickenpox yet, and let's say they start to get a fever before their rash develops, you wouldn't be like, oh, they only have a fever, so it's fine for them to come back to school. You would exclude them because they've started to develop symptoms after having close contact with their sibling who has chickenpox. It's the same idea. So we've been doing this for ages. Some of you have been doing this for ages longer than I have. So same idea. And then if you remember from the last time we were all together, symptomatic students and staff can return with just one negative antigen test. It could be a PCR as well, but just one test is fine while we're in low transmission. If we jump up, we'll relook at that and think about serial testing, but for now, one test is fine. Keep doing what you're doing. And then you probably already know this by now, but masks are no longer required on school transportation. You can require it if you would like, but CDC is not requiring it. And then masking is still required in healthcare settings, which includes the nurse's office. So make sure everybody's masked in that setting. Oh yeah, and we did have one submitted question, but it was answered by some of the content that we've already gone over. So that is everything I had. Kelly, go ahead and open up the chat. I will stop sharing my screen. All right, if anybody has any questions, feel free. Otherwise, all of these links will be sent out when the slides get sent out if you need to pass that on to legal or anything like that.
We have a quiet group today.
Well, that's refreshing and encouraging that we're kind of getting the hang of things.
It's very encouraging. It only took about 3 years, didn't it? Felt like 20. But if you don't have any questions, we can adjourn a little early, give you some more time in your afternoon. Here's some silence is golden, Jenna said. And here's a question. Per our attorney, we cannot exclude asymptomatic students. Your guidance is the opposite.
Yes, you can exclude asymptomatic students if there are a case. So if you know that they've tested positive by law, you followed up with for close contact. Close contacts in the course of contact tracing should still be excluded if they're not vaccinated. That is written into like what's the proper guidance for quarantine for COVID-19, which again, I'll send out these links for you to look up. It's surprising everybody that they have to become familiar with public health law. Okay, never mind. There's a lot of questions. Bear with me, everybody, while I scroll up to the first one. What are the recommendations for international travel for unvaccinated staff? I'd have to check if this was recently changed, but to the best of my knowledge, it hasn't. And for staff, they should, if they're not vaccinated, have a short travel quarantine of around 5 days, and get tested during that waiting period, since they're not students. For an unvaccinated student, they'd be able to return right away because we don't want to be denying people their education. All right. Lawyers in my district still say we can't enforce mask wearing after 5-day quarantine for COVID positive students. Any recommendations? Keep saying. So my recommendation here is that if you have a case and they need to isolate, the definition of the proper isolation period for COVID, which like isn't specifically written into the law says follow whatever the isolation guidelines are. It's 5 days with a mask or 10 days without a mask. Those are the options. If they're not going to mask, then they've got to be out for 10 days. I think, for some families that have had issue with masking, when you say that their kid can return early, usually they're willing to comply. All right, next we have a lot of students come to SHIELD testing without masks. SHIELD employees are requiring students to wear masks, which means we are giving out boxes of masks each time students do SHIELD testing. I have heard about this in the districts closer to where I live too. They put them on to get a tube, take the mask off to spit in the tube, then put masks on to turn in the tube. If SHIELD is requiring masks, can we have your advice on how to keep up with this demand on our resources, having to provide masks to students who don't bring masks from home? This may be a good use. Kelly, let me know if we're still doing PPE requests for schools. It may be a good use of that resource, or send a note home if to the people who are participating in SHIELD to remind them to have a mask on them for their SHIELD testing day.
I'm going to ask Jenna to chime in because she is one of the people who's in charge of fulfilling those requests. Jenna, are we still fulfilling PPE requests?
Well, I only do the by next testing, but they are still taking requests for PPE based on the supply we have. So I don't have current knowledge of the PPE supplies, but we are still taking requests.
Okay, thanks, Jenna.
Is SHIELD testing considered a healthcare setting? You know, that's a good question. I feel like IDPH would say yes, but I'll ask them when we have our meeting with them next week just to double check. But again, that's kind of a tricky situation because if SHIELD is requiring it, but you guys have to be the ones who are enforcing it, that might be a little bit of a gray area. But if you want SHIELD to continue to come perform the testing, I would say you just have to comply. But again, I'll check with IDPH next week to see if we can get some documentation about whether that's a healthcare setting or not. If a student refuses to wear a mask in the health office, what is your option to see the students who came to see the nurse? That's a tricky situation. Obviously, if they've come to the health office, they probably have some sort of issue that needs to be dealt with. And I don't think you can really turn them away. Definitely remind them that this is a mask space, that's to protect them, it's to protect everybody else in the health office. But if this is a kid who's having some health issues, obviously you need to take care of that. So in that situation, if you've done all the reminding you can, you've kind of talked to them about it and they're still not going to do it, do your best to protect yourself and anyone else who's in the health office. I think that's all you can do in that scenario. All right, I'm seeing some comments about the CD code and interpretations. Obviously, I have an MPH, I don't have a JD, but there are varying interpretations of the CD code, or if you guys didn't know, CD code is the communicable disease code. I'm sorry if I didn't specify that earlier. I think IDPH would generally disagree with some of these interpretations, but I can't give any kind of legal advice about it because I'm not qualified to do that. So ultimately, because you guys are the ones enforcing things, you have to defer to your legal counsel, and we'll try to provide you with all of the resources, the science to back up, you know, safety as much as possible. But obviously, you have to defer to your own legal counsel since we are the public health experts, not the law experts. Any recommendations on end of school year events like dances? So assuming things go well, I would still recommend having them outdoors to the best of your ability, and then spacing people to the best of your ability. But if you're careful beforehand, and we're still in low transmission, it would be safe for people to gather. I guess we'll have to see where we are with transmission as we get a little bit closer, but for the sake of planning, go ahead and do some preliminary planning, assuming we're still going to be in low transmission. And hopefully we stay that way and can have events like prom and things like that. Is there a timeline for the decision tree? I wish I knew. We ask about it every week. It's basically on the last leg of signatures, but I don't know when that approval is going to come. I know the people who worked on it at IDPH are frustrated with the timing of it, but hopefully we're waiting for that to see. They had a final decision tree before the CDC came out with their new risk category, so then they had to redo it. That's part of the delay. Is CCDPH working with lawyers to clarify all the issues with the guidelines? The short answer to this is no. Basically, the process for the communicable disease administrative code is we as a state, all the public health experts have a series of meetings to go over any changes that have to be made to the code, updates to the science, things like that. And it's a long process to alter. So I don't think the general communicable disease code is going to be able to change anytime soon. Any kind of big changes would have to come from our actual legislators making something into law. We will help you to the best of our ability to interpret things and put it in the context of science, but our legal team is just a small group that helps us draw up orders and things like that. So ISB and IDPH are working to clarify things, and hopefully we'll hear a little bit more about that next week, because I believe ISB was looking into instating some consequences for schools that still aren't like contact tracing or basically doing any kind of mitigation measures that are still recommended, but we'll find out more about that. I know that's really frustrating, and I can honestly say I never expected to be doing this much public health law. That's one of those branches of law that it's like environmental health law and immigration law. Not a lot of people go into it. We'll see if there's any more questions coming in, but for now I'll toss it to Kelly to do any more reminders, and otherwise, if your question didn't get answered or you think of it afterwards, just send it over to the CCDPH school email.
Sure thing. Thanks, Lex, for answering those questions. I know it can be a little confusing, so we'll try to make sure we get any questions answered and cleared up. And we keep a copy of the chat so we can make sure we can refer back to get those questions answered. If there aren't any new questions, then we're going to let you have the rest of your afternoon, and we will see you back April 1st. I know that some schools will be on spring break, but the majority of schools will still be in session, so we will be here, and we will keep you posted if we decide to alter our schedule or change our format as a response to the decreases in the COVID cases. We will keep you posted, but thank you and be well and have a great weekend.